Hi guys, welcome back to the digestive system, part 2. Yesterday we talked about some general aspects of the system, including its innervation by the autonomic nervous system. And today we're going to talk about the anatomy. And of course, the digestive system begins at your mouth. I guess, watching this MRI is kind of fascinating. I wonder if you can tell me what he's saying. Anybody a lip reader here? But what we're looking at, of course, is the oral cavity, and that's where it all begins. So the oral cavity is the first segment of the digestive tract. It's the site of ingestion. To ingest means to take in, and mastication. And mastication explicitly means it's the mechanical digestion with the teeth, right, and your tongue. So that mastication, that mechanical digestion, prepares food for chemical digestion. If you look down here in the diagram, you'll see, you've got this big muscular tongue. Up top, we've got a hard palate made of bone. The teeth cut things up. Of course, there's secretions from your salivary glands that'll contribute to this. Each of the different teeth have a form for a specific function, whether it's to cut, to tear, or to grind. And so let's talk about the tongue here. Big muscular organ, 4 different muscles that make up the tongue, and it's attached to the bottom of the mouth with to the hyoid bone. If you remember this from our skeletal system, the hyoid bone is just suspended under there, and it articulates with the styloid process of the temporal bone. Okay, and those 2 bones allow for the swallowing reflex to occur. So anyway, the tongue is divided into 2 parts: the oral, right? That's the front part of the tongue, and then the pharyngeal. The tongue's role is to roll up food into a bolus, okay, and it uses the roof of the mouth and the ridges on the roof of the mouth to turn your food into little slimy balls so you can swallow them. It's covered in sensory organs, taste buds, and these little protrusions called lingual papillae. All right, so lingual papillae are on the tongue. And of course, you couldn't speak without a tongue. So the tongue is responsible in large part for the sense called gustation. And gustation is the sensation of taste. And so you have these little taste buds that cover the tongue. They're also called gustatory cells, and they're located in these protrusions called the lingual papillae. Now, there's 5 elements of taste perception: salty, sour, sweet, bitter, and last but not least is umami, right? That's that savory flavor, that chicken soup flavor that's really the neurotransmitter glutamate. And I know when I was a kid, they tell you could taste bitter with the tip of your tongue and sweet with the sides, but that's not really true. You find these different taste buds more or less evenly distributed throughout the whole tongue. There are 4 types of lingual papillae, and all of them, except one, contain taste buds. The fungiform, fungi, of course, refers to the fact that they look like mushrooms, and these guys are mostly on the top of the tongue. And the foliate papillae, these are hidden. These are ridges and grooves towards the back part of the tongue. And then the circumvallate papillae are kind of notable. You can see them. They are circular, and they have little rings around them. And there's only a few of them back there, just before the pharyngeal part of the tongue. And then last but not least, the most common of the papillae are the filiform, and these are the ones that don't really have any taste buds. So the tongue works in concert with the palate. The palate is the roof of the oral cavity, and it's made up of the maxilla bone. So we have 2 parts to your palate: the hard palate, the soft palate. The hard palate's the roof of the mouth. You can feel it's got ridges up there called palatine rugae, right? Rugae means ridge. And as we move back through the palate, you get to the uvula, right? So that's the uvula is an extension of the soft palate and is associated with the gag reflex. One of the fairly common congenital birth defects in children is a cleft palate or a cleft lip, and so just in the U.S. alone, we have 1 in every 1,600 babies is born with one of these deformities. And the fact is, you can have a really good outcome with this relatively simple surgery. Of course, that's not the case for the vast majority of children around the world, and so one of the charities that I think is worth contributing to is something called the Smile Train. And for $250, you can have a third world kid's cleft palate repaired. Of course, the guys that do the jobs are doing it pro bono, right? They just travel around the world and do free surgeries, which is a nice way to contribute to the world. And one of the surgeons that's involved will be a maxillofacial surgeon, which is really a dentist, but you do some cool stuff. Maxillofacial surgery might be a nice way to make a living. So here's another diagram of the palate. Remember, those palatine rugae are associated with rolling the food in concert with your tongue up into a ball. And down bottom, you can see just how problematic a cleft palate can be for a baby. Next are teeth. So this mastication is accomplished by the teeth. They vary in size and shape and location. And we've got 4 different types: incisors, cuspids, molars, and premolars in the adult teeth. So we have 2 waves of teeth that come through, the primary and secondary teeth. You're born with your primary teeth, and they emerge through the jawline at a few months, or starting at 6 months. And of course, in the end, they're going to be replaced at around 6 years of age with those secondary teeth. Okay, you have 20 baby teeth or primary teeth, and then in the end, you should have 32 permanent teeth. And of course, you actually have these vestigial teeth, the wisdom teeth, and they're vestigial in the sense that they were useful because back in the day, I guess by the time you're 16, you'd probably lost a couple teeth already, and those other teeth could emerge back out. If you dissect a tooth out, you find, of course, that it's covered with enamel. That's a nice, hard, white stuff that surrounds the tooth. And, one of the things you're going to have in your toothpaste probably is stannous fluoride. Fluoride's super reactive. It hardens that enamel, and it actually bleaches it as well. Just beneath the enamel, we have the dentin. And at the center of the tooth, we have a pulp cavity that has a blood supply and nerve supply. And of course, the part of the tooth that emerges, that's covered with enamel, is called the crown. And below the gingiva, the gum, we find the root. Now remember, it's kind of hard to get teeth out of your head. You have to pull them out, pop them out, and that's because you have to rip a periodontal ligament. So periodontal ligament holds that tooth in place and makes it tough to pull out. Remember that if you go back to our discussion on joints, this is called a gomphosis. At the bottom, you see the results of some poor dental care. I think this damage is due to exposure to antibiotics, the streptomycin. Over here, this person's dental hygiene seems to be a little lacking. So looks like probably somebody who's got severe substance abuse or probably mental health issues or both. Take good care of your teeth. Your dental health and your cardiac health are intimately associated with one another. The data just keeps pouring in over that. Surrounding the oral cavity are a bunch of salivary glands. There's the parotid, the submandibular, and the sublingual gland. The parotid gland is this big one. It's around your jaw, the rear of your jaw, and it secretes a serous fluid that's full of amylase. Amylase is an enzyme, and it specifically attacks the alpha 1,4 glycosidic linkage that you see in starch molecules. Remember that? Remember, starch is a long chain of glucose molecules joined together at carbon number 1 and carbon number 4. And so that's what amylase attacks. It breaks down starch into monosaccharides. We also have the submandibular glands. It's just underneath of the mandible. And last but not least is the sublingual glands. And that's this little thing right underneath your tongue. And if you squeeze on it and suck on it, you'll get saliva out of that, which was how I used to get a drink when my mom would lock me out of the house in the summertime. I'd be so thirsty. It was terrible. The back of the oral cavity is called the pharynx. It is the gateway down into the esophagus, and it's divided into 3 sections: the nasopharynx, right up near the nose, oropharynx, and then the laryngopharynx. All right, so that's right where the epiglottis and the larynx are. Well, you can see here in the illustration that one of the things that happens when you swallow is that essentially the trachea and the tongue and the floor of the mouth all are drawn up. If you try to swallow, you'll see that's exactly what happens. Those muscles on the floor of the mouth, connected to the tongue, contract. They pull the hyoid bone up, which causes the epiglottis and the trachea to move up and close, which allows fluid or solids to pass down the esophagus without entering the trachea. Now, one of the problems with your swallowing reflex is that if you've had something like a stroke, lots of times the nerves that coordinate this activity are damaged. And so people that have stroke often have to spend time with an occupational therapist to restore their swallowing reflex, because you can't really not have a good swallowing reflex, because if you start to get fluids or food down in that trachea, you're going to end up with pneumonia. And of course, that's one of the most common reasons that people die in hospital. I think we'll stop here, and we'll pick up tomorrow at the esophagus.